and welcome. This is Season 2, Episode 3 of the Active Health Podcast. I'm Dr. Juliet McGrattan, author, speaker, and former GP on a bit of a mission to help people find good health and happiness through putting on a pair of running shoes. Now, however you found your way here today, I just wanted to let you know you can download this show on all your favorite podcast apps. All you do, go to the search bar and put in Active Health. You'll also find all the episodes from Season 1 there as well. Thanks, as always, to Wisp Sports for hosting the show. Do give them a follow on social media at Wisp Sports, and you can find me at Dr. Juliet McGrattan. Now, in this series, I'm talking to both runners and health experts to dig into the problems that women face when they're trying to stay active. From breasts to blisters, diarrhea to depression, there really are no taboo topics. And that's just as well because today we're tackling a particularly taboo one, stress incontinence. Now, as you may know, stress incontinence is when you involuntarily lose urine from your bladder, so also known as peeing yourself, particularly triggered by coughing, sneezing, and high-impact activities like running. Now, this is a huge barrier to women when it comes to running, and many women don't even try or start, and those that are already running often stop. If they don't stop, then they're coping with wet running tights. They're afraid to hydrate properly before they run, while they're running, and they're always looking out for a toilet. It really is such a big problem. And I wanted to explore this and really to find out how massive a problem is and to explore what women can actually do about it. I've got a fabulous guest who's going to explain everything. When I decided this was what I wanted to talk about, I knew exactly who I wanted to ask. So I want to introduce you to Emma Brockwell. Emma is a pelvic health physiotherapist based in the UK, but she goes far beyond just seeing patients in a clinic, and she's made an impact both nationally and globally to women's pelvic health. She's a founding member of the collaborative campaign group called Pelvic Roar. She's on the Scientific Clinical Advisory Board of the Active Pregnancy Foundation and the Perinatal Physical Activity Research Group. And she co-authored the UK's first return to running postnatal guidelines, which are guidelines I'm constantly referring to in the work that I do. And to add to that as well, she's an author of a wonderful book called Why Did No One Tell Me? And that's an absolute must buy for every pregnant woman and those who are looking after that woman. Honestly, I buy it for all my pregnant friends. Now, I know Emma's going to feel really at home on the podcast because she's got her own podcast called At Your Cervix, which I think wins one of the best titles of podcasts ever. She runs, she set up her own local running club. She's got a young family. She's basically one of those all-round super women. And I'm really grateful that she's here today. So welcome, Emma.
Oh, thank you, Julia. I'm so excited to be here, not only because I get to speak to you, but because you're talking about stress urinary incontinence during running. It's just not talked about enough. So I'm thrilled that you're covering this topic today. So thank you so much for your lovely introduction. And thank you very much for having me.
You're very welcome. Let's start by talking running. Tell me about your last run. Have you run today? Did you manage to sneak one in?
Well, I am very proud and smug to say, yes, I did. I nearly didn't because it's cold and wet and it's very muddy. And I have to say, with all that's going on with Christmas shopping and tying up work and all our loose ends, I just thought, oh, shall I put it off? Shall I just go tomorrow? But like anything, when it's this part of your routine, which mine is, I always go for a run just after I drop the kids from school. Once you've done it, you just never regret it. So delighted to say I've been, and it's part of my everyday workout, really.
Brilliant. Well done. Yeah, you see, it's hard at the moment just to find that time. There's so much pressure on our time.
Oh, it really is. Time and just weather. It's hard in this country, I think, sometimes, but it's so worth it when you do it.
Fabulous. Well done. Well, let's talk about stress incontinence. I mean, maybe, we're a bit overexcited about the topic. I don't know, but I really wanted to tackle it. But how big a problem is it? Can you give us some stats of, I've heard 1 in 3, 1 in 4 women are affected by it. What do you say?
It is a real big problem. And the reason I am so excited about talking about it is because I'm pretty sure that the majority of women listening will unfortunately, at some point in their life, experience some element of pelvic floor dysfunction if it isn't stress urinary incontinence. But stress urinary incontinence actually affects, we think, around about 1 in 3 women. I probably think it's higher than that, but it's underreported in my opinion. We certainly see women who exercise, unfortunately, are about 3 times more likely to leak urine. And that prevalence increases as the exercise that you're carrying out increases with impact. So runners are prone to stress urinary incontinence. That doesn't mean to say you shouldn't be running, because benefits of running way outweigh the risks of it. But when you are experiencing stress urinary incontinence, it's not something you should put up with. It's something that you can get treated. So yes, it's unfortunately common, but it's not normal, and it can very much be treated.
So from what you said there, would you say that those activities are causing it or just revealing it?
That is the big question. And I thought you might ask me that. The jury's out a little bit at the moment, because this will come as no surprise. There's not enough research to absolutely ascertain that. I think logically it makes sense that if you are creating an increase in intra-abdominal pressure, and there's lots of ground force reaction, the chances are that you are going to leak more so than if you are doing a low impact exercise. But we don't absolutely know that it's the exercise that's causing it. I would suggest that research coming out later next year and over the following years will probably reveal that it is a risk factor for stress urinary incontinence. But we're stressing a muscle that most of us don't really strengthen or even are that aware of. So it would make sense that if you're asking a lot of a muscle that's not strengthened, it at some point isn't going to work as efficiently. So by hopefully addressing that strength deficit, that should improve symptoms and certainly not be a reason not to run.
Good. Okay. That's interesting, isn't it? Because you want to tell people to keep running, but at the same time, it was always weighing up risks and benefits of anything.
It's exactly that. It is a risk versus benefits. And I'm not suggesting, and I'm sure we'll go into this in more detail a bit later, I'm not suggesting that if you are leaking that necessarily you should keep running. But I'm really keen on women being aware of the fact that because they're leaking, often they won't come and see me because they're scared that a pelvic health physiotherapist like myself will say, right, we'll never run again. And that's very not the message that we should be giving out. It should be that, yes, you're leaking. Let's deal with those symptoms, and then let's get you back to running as effectively as possible.
So who is coming to see you? Who do you find presents to you being affected with this? Who's most likely to make an appointment?
So the women I tend to see are often pregnant or have just had a baby, so going through their postnatal recovery. And that's partly because that's the area that I specialise in. I would also say that that's a time when we become more aware of our pelvic floor, partly because we're talked to about it, but also partly because that is often a time when you are more likely to notice these symptoms occurring. And it makes sense when you've got a big weight growing inside of you, that pelvic floor muscle's got to work a lot harder. And again, if we've not really ever engaged with that muscle, we haven't strengthened it, therefore it's not used to meeting the demands of a heavier load that's occurring through all of these pregnancy changes that are occurring. So I would say typically you may experience pelvic floor dysfunction or stress urinary incontinence more so around pregnancy and after pregnancy. And again, once you've had baby, when you've birthed baby, doesn't matter if it's via C-section or vaginal delivery, that's going to stress the pelvic floor and weaken it. So again, you may become a little bit more aware of those symptoms at that time of your life. But pelvic floor dysfunction and stress urinary incontinence isn't exclusively for women who have had children. Any woman can have pelvic floor dysfunction or stress urinary incontinence. You will often see it or I'll often see patients who are perimenopausal or postmenopausal experiencing stress urinary incontinence. And that's because of the effects of the change in hormone. And our pelvic floor muscle loves estrogen. It has lots of estrogen receptors. And when we hit the menopause or the perimenopausal years, estrogen starts depleting. And that has sometimes a negative effect on your pelvic floor. And again, that's when you can become symptomatic of pelvic floor issues. So it can affect any woman of any time. And I want to also highlight that it can affect younger women as well. So lots of women that I treat quite a few netballers and obviously runners who haven't yet had children. And again, I don't know if it's because of the sport they do, but the research is pointing towards the fact that because they're doing lots of high impact exercise, that could be affecting their pelvic floor. And we are seeing lots of young athletes suffering with pelvic floor dysfunction, unfortunately, too.
So I've got two things from what you've said. The first one, I don't know, it's only really kind of occurred to me, but if you're pregnant and the baby is slowly growing and, as you say, putting increasing weight on your pelvic floor, doesn't that in itself strengthen it? Like if you want to strengthen a muscle, then you gradually increase the load that you put on it. So is it more the delivery that causes the damage, if that's not quite the right word to use? Does that make sense?
Yeah, it totally makes sense. If you're already at a low starting point with your pelvic floor, let's say it's never been a pelvic floor that's been particularly strong, then having that extra load on you, which you're right, increasing load on a muscle helps. But if it's too much load for a muscle that's already at its lowest ebb, it's going to struggle more with that, which is why you can see women during their pregnancies experience pelvic floor dysfunction. However, you're right, women who have had a vaginal delivery are definitely more at risk of stress urinary incontinence than a woman who's had a cesarean section. But the biggest issue with that is that women who have had cesarean sections often don't think they need to do any form of pelvic floor exercise at all. And that's just not the case. Having had such a heavy load on your pelvic floor is potentially going to increase, or certainly potentially weaken, the pelvic floor, so that then possibly as you get older and those hormonal changes occur, that deficit is going to become an issue. And then you might find that later in life, you then develop stress urinary incontinence. And a lot of really what I do is around about prevention. So I love the fact that I see women who aren't having any urinary leakage at all during their pregnancy, aren't experiencing any postnatally, but they want to prevent those symptoms happening later in life. So it's just a flag to say that because you had a baby, because you've been pregnant, you are absolutely going to have a slightly weaker pelvic floor regardless of delivery, and therefore address that strength deficit now so that then you don't have any problems later in life.
So even if you think you're fine, even if you're you've had a baby and you're back to running and you've no leakage, you're kind of not necessarily going to get away with it. You've got to take some kind of action to protect you for the future.
Yeah. And I just think generally we need to think about our recovery postnatally after having had a baby. We should be thinking of it more in terms of almost like a sports injury, if you like. We should be rehabilitating women. That's the time in your life where your body goes through the biggest amounts of changes that it will probably ever go through. And you wouldn't experience that sort of bodily change at any other time in your life without rehabilitating. And the point is that all the muscles in your body change and lengthen and weaken slightly during pregnancy, and that's perfectly fine. That's part of the process. But it's kind of madness that then we don't address those weaknesses and get you stronger and back to the old you after you've had your baby.
Yeah, definitely. It makes perfect sense. And I'm glad that more and more women are becoming aware of this, particularly through your book as well. Really, there are things I wish I knew when I had my children, definitely.
Yeah, me too.
If there's somebody listening to this who's thinking, oh, crikey, okay, I need to go and see a women's health physio. What's the first thing that you do in terms of like assessing someone? What can they expect when they come along?
So the first thing we do, we're really lucky as physios in general because we'll often get a lot of time with a patient. So ordinarily, the first appointment I have with someone is an hour, whereas I think with you as a GP, it's about 7 minutes, isn't it?
Yeah, when I was doing general practice, I would get 10 where in my practice, yeah.
how you get anything done in that time is beyond me. But I have the luxury of an hour. So we will spend quite a lot of time taking history, getting to know you, finding out what's happened. Perhaps if it is pregnancy that you're here to see me for, postnatal recovery, we'll talk about your pregnancy and your childbirth. We'll talk about your medical history and get a really good idea as to what you want to achieve from the appointment itself. So set some goals and really, really almost get to know each other so that you feel comfortable with more of the physical assessment. And there is a physical assessment. It's entirely up to you as to whether you have the physical assessment. But the physical assessment will involve looking at you globally. So looking at you from head to toe, looking at how all of your muscles interact, how they work, but then also having a look, ideally, at your pelvic floor, your vulva, your vagina, looking at everything internally to ascertain if we can see any signs of pelvic floor dysfunction, for example, pelvic organ prolapse, but also looking at how strong your pelvic floor is as well. And once we've had a look at you as a whole, we can then put together a nice treatment plan to optimize your recovery and your rehabilitation.
What's that likely to look like? Things that you just do at home?
Depends with what you present with. So if you're only thinking of stress urinary incontinence, then yes, ordinarily it would involve a program for your pelvic floor strength. And it would also, from my side, look at giving you some exercises to address your global strength as well. I don't think it's enough just to give pelvic floor exercises, because this little muscle at the bottom of your pelvis, it doesn't work alone. It works alongside lots of other muscles, including your bottom muscles, your glutes. So if you are stronger on the outside, that's going to help you on the inside as well. So often I'll give you a couple of exercises that involve those muscles as well, so that we're really strengthening that whole pelvic area. And you're likely then to rehabilitate, hopefully, a little faster than if we just focus on the pelvic floor. And if it was just pelvic floor exercises or pelvic floor, the muscle that was the issue, most women would find that as they do their pelvic floor exercises, they would get better on their own, but it's not always quite as simple as that. So I like to give you a whole mishmash of things to be getting on with.
And time-wise, roughly, how long is it going to be before it gets better?
Or the pressure. The magic number is, it's variable from every woman. If you are compliant and you do your exercises as advised, I'd like to think by about 6 to 8 weeks that you're starting to gradually notice some improvements. Like any muscle, we're really looking at about 3 months and beyond. So for most patients who are really compliant, around about 3 months.
Yeah, it's a long time, isn't it? And I've been given physio exercises in the past for other types of injury, and know how hard it is to stay motivated to do them. You just forget.
Absolutely. And, even now I forget to do my pelvic floor exercises. No one's perfect at this process. I think what's so complicated with pelvic floor dysfunction is because for most women, it doesn't hurt. You don't always have that reminder that there's a dysfunction there. And, it's easy to brush it under the carpet and think, do you know what, I'll address that later. Pop a pad in when I go for my next one, and I'll do my pelvic floor exercises another day. So I get it. The compliance is the hardest part. And it's the same as putting on your trainers to go for a run. Once you've done it, you never regret it. But it's just reminding yourself, making it part of your routine is key. And once you've done that, you're on a pretty good road to recovery.
And the golden question, do you have to stop running?
The answer is it depends, annoyingly. It really depends on you, the individual. If you are someone that leaks as soon as you start running, then it might be that I say to you, okay, look, all that's going to happen is if we keep running you, possibly your symptoms are going to get worse, and they're probably not going to get better as quickly as we'd like them to. So therefore, why don't we try and find an alternative to running for a short period of time whilst we just give the pelvic floor time to strengthen? So I am someone that's very anti taking exercise away from anyone. I think it's something we all need to be doing, but I'm keen that you might need to find an alternative for a very short period of time. And then as soon as we can, as soon as we've got that window of opportunity, we might then start introducing a walk-run program so that you're doing a little bit of running and getting that running fix. However, if you're someone that doesn't leak until you are 45 minutes into your run, I probably wouldn't pull you back from running. I might just say to you, okay, well, let's keep running for 30 minutes and then go into some fast hill walking, for example, because it's really important that to keep you compliant within this rehab regime, we've got to be doing things that you enjoy because you're just not going to stick to it otherwise. But it's also really important for you to know that as soon as we can get you back to running, we will. And I like to reframe pelvic floor issues as any other sporting injury. So if you came and saw me with a sprained, really swollen, really painful ankle, you're probably going to expect for me to say, let's not run for a little bit. And you'll probably quite gratefully do that because it'll be too uncomfortable to do that. So if you can frame pelvic floor dysfunction in that way, that actually it's an injury, my body's injured, it needs rest, it needs time to recover, then I think that reframing can almost give you permission to pull back a little and understand that your body needs time to recover.
Yeah, I get that. It's hard, isn't it? Because like you say, it's for many runners, it's so intrinsic to their life and their well-being mentally and physically. But I guess in the long term, when you look back and think, well, it was only X number of weeks that I had to stop for, and I'm much better, then it's worth sticking it out.
Yeah, it is. But I think actually something you said earlier is really spot on. It is about balancing the benefits and the risks. And if running for you is absolutely the most important thing for your mental health, we as a therapist need to have a really good think, well, is it the right thing to be pulling you back from your running? Shall we try you running, try you strength training and see if actually you do improve, so that we're not having such a negative effect on something as important as your mental health? So that's why really it depends. It depends on you and your needs. It's not as simple as, never run until you're better, because it's really not that simple.
Can we get a bit technical? Because I'm quite interested in running technique, and I'm just wondering if you know any evidence, or if you even just anecdotally find with people that you see that it's more common to have stress urinary incontinence with certain running styles. So I was thinking if people are really landing on their heel, or even the opposite, landing on the forefoot, do you find that makes any difference to stress incontinence?
I'm sure this won't come as any huge surprise that there's not a huge amount of research on this at the moment.
No, fair enough.
But anecdotally, I definitely find, if we're thinking of trainer runners versus barefoot runners, that there is an increase in leakage for those that barefoot run if they're leaking. And that makes sense because obviously you're not shock absorbing in the same way as you would with trainers. So quite commonly, one of the step backs I'll take with some of my runners who barefoot run is to say, right, you may need to wear some trainers for a short period of time until we help resolve some of your symptoms. But from a gait analysis perspective, I think it's really important that we are carrying out gait analysis for women who leak. And typically I will see that a lot of women, particularly postnatal women, often overstride. And that overstriding can, it seems, lead to a little bit more leakage. And if we adapt that overstriding, then we can see that actually sometimes the leakage reduces quite significantly. I'll also often see women who don't rotate so much in their thoracic spine. That can lead to some leakage as well. But that again, to me, makes sense when you think of where the diaphragm sits underneath your rib cage, attaching into the thoracic spine, and your diaphragm via your deep back and tummy muscles interacts with your pelvic floor. So it's a little pump system, really. That whole core cylinder is pumping up and down as we're running. And if we're fixing at our thoracic spine and not really rotating, then perhaps there's an argument to say that your pelvic floor and diaphragm aren't interacting as efficiently. So by introducing a little bit more thoracic rotation, that for some women, again, can reduce the amount they're leaking. You'll often find as well that some women really lean forward from the trunk. And as a result of that, again, you can see some increase in leakage there. But the majority of women I see are heel strikers. And to be honest, it's not often the strike of the foot that I'll change. It's more often or not something like the cadence, for example, that I would change so as to reduce the overstride. I hope that makes sense.
Yeah, it makes perfect sense, because I think women that overstride often do land on their heel. So simply by shortening the stride, they may well be landing much more centrally over their foot, with their pelvis in line with their knee, in line with their ankle.
Yeah, absolutely.
Or has a knock-on effect. What did you mean by thoracic? They're not thoracically rotating when they run. Do you mean they're just holding themselves very stiff in the upper body?
Yeah, absolutely that. And actually, another thing that I'll see in a lot of runners that leak is they hold their tummies in as well. So there's a lot of tummy gripping going on. And I think for some women that's to try and help them stabilize around their pelvis. But I also think for some women that is just because as a society, we like to hold our tummies in because we like that flat tummy look, which we don't need. And by holding tummy in and not allowing your arms to swing, just can create a little bit more pressure. And when your pelvic floor is weak, pressure isn't always your best friend if there's too much of it. So by holding yourself really stiffly and not rotating, that can anecdotally seem to increase some symptoms of stress urinary incontinence.
So be relaxed is the best.
Be relaxed. And I quite like the cue of taking your arms or your hands from hip to mouth as you run. So I don't know if you see it, but with some runners, they tend to cross their arms across their chest.
Definitely.
And it's just not a great thing to do when you run, particularly if you're someone that leaks urine. So if you then just think about taking your elbows back so that your hands are almost lightly skimming from mouth position to hip position, that will then just increase some of your thoracic rotation. I'm actually doing that as I'm talking to you, which is really quite odd. I'm so pleased the video's off. But you'll find that just increases some rotation. It actually allows your tummy to relax. Sometimes that can then improve your breathing, and breathing is intrinsically linked to pelvic floor function as well. And for some women, that can just make such a difference. And sometimes it's not all about, as I said, the pelvic floor being weak. Sometimes it's just about linking up these parts of the chain that have become a little bit disconnected for one reason or another.
Brilliant. And you mentioned bottom muscles before, the glutes.
Yeah.
Is it better to tuck your pelvis under a little bit when you run, or to let your kind of pelvis tilt a bit anteriorly forward in a forward direction when you run? Because I know that lots of runners have lazy glutes, and I include myself in that.
Me too.
Yeah. Can you kind of fill us in on the role of the bottom and the angle of our pelvis?
Yeah, do you know, the pelvis, actually the angle of it, whether it's anterior, forward tilted, or posterior, backward tilted, I don't tend to focus on a huge amount. And there was a paper done last year by Shefali Christopher. I think it was 2020, actually. Yeah, 2020, I think. And she actually she looked more at musculoskeletal pain impairments in postnatal runners. And actually, one of the things that she found to be less of an issue was pelvic position in changing pain. And I appreciate we're talking about pain, not stress urinary incontinence, but actually the two are quite intimately linked. You'll often find that postnatal runners who are in pain often leak as well, interestingly. But I tend to look more at the cadence, as I've already said, but also more at what the global muscles are doing. So your glutes. I think your glutes are your pelvic floor's best friend. So they're actually linked. The fascia's linked internally into your external hip rotators, which are called your obturator internus. So all of these muscles are really intrinsically linked, and your pelvic floor just doesn't work alone. So I often will work with glutes, strengthening glutes, because that seems to have a really positive effect to the pelvic floor. So I tend to focus more on strength training. And then what you'll see is that the pelvis tends to adjust. And certainly with your postnatal runners, what you'll tend to see is something called a pelvic shift. So that's where your pelvis is moving up and down as opposed to what we're talking about, which is forwards and backwards. Does that make sense? So you're getting more of a hip tilt as opposed to that anterior and posterior tilt. So when your glutes are a bit stronger, you'll tend to see that there's a reduction in that pelvic tilt, which anecdotally seems to improve symptoms, particularly of stress urinary incontinence.
The last podcast I did was about strength training for runners. So another reason why we should do it, particularly as women.
Oh, it's so important. It really, I can't emphasize enough. And particularly after you've had a baby, your glutes definitely don't work as well. I just don't think runners can run without that strength and conditioning component into their regime.
Yeah, and particularly the glutes by the sound of it.
Yeah.
Brilliant.
Yeah.
Are there any exercises in terms of strength that you would avoid if somebody has stress urinary incontinence and is getting treatment and working on their glutes and their pelvic floor? Are there things they shouldn't be doing?
The things they shouldn't be doing are things that might cause them to leak more. So I'm a firm believer that we shouldn't ever say no to any exercise because that induces fear. And we want more and more people to exercise. So I'm a firm believer that we should be encouraging all forms of exercise. But obviously, if you are leaking when you run and you're also a CrossFitter who leaks potentially when you're carrying out box jumps, for example, that's not going to be a great exercise. Although it's a great, strengthening exercise, it's not going to be a great exercise to help resolve your symptoms. So it's more about listening to your body and being honest with yourself and saying, well, you know what, I love squat jumping, but it's actually causing me to leak more. Therefore, I need to just pull back from it until my symptoms resolve. So I would say find the exercise that you enjoy, because that's going to keep you on track with your strength and conditioning, but be sensible with what you're doing. Make sure it's not creating more symptom. That's sitting on the fence, isn't it?
No, I like your approach. Like there isn't any absolute don't do's for everybody. It's just taking each person individually and trying to work with what they can manage and avoid those things that are making symptoms worse, but not having an absolute is very healthy, I think. What about for runners who most of the time they're okay and they don't leak, but say they just find they leak a little bit when they're going downhill, or if they're in a sprint finish or something, or they're doing kind of running drills, like I suppose a bit more like netball type things with twisting and turning games and things, but they other times they're fine. Are they okay just to do some pelvic floor exercises, or should they really be trying to get assessed?
I would. Any sign of urinary leakage really truly is a sign that you should be getting assessed, just to absolutely check why you're leaking urine. And actually, it might be as simple as your pelvic floor is a bit weak, but we definitely know that about 70% of women don't do their pelvic floor exercises correctly if they just follow the guidance on a leaflet. So often I'll see women who think and are frustrated when they come to me because they think, well, I've been doing these pelvic floor exercises, but they're not making any difference. And it's often because they're not technically doing them correctly. So it seems a shame to waste weeks and weeks trying to do this exercise when actually having something like an internal biopelvic health physio can really get you on track quicker. And when women leak when they're running downhill or when they're sprinting, often that's because the pelvic floor is working pretty damn well because you're not leaking on the flats. But it's not strong enough to cope with that increased demand of intra-abdominal pressure and ground force reaction. So it is a sign probably that your pelvic floor is a bit weak, but it might just be for you that doing the bog standard 10-second holds 10 times and 10 fast reps just maybe isn't quite enough for your pelvic floor, and you need a little bit more than that, or you need a little bit more globally. And therefore having that input, that bespoke input from a physiotherapist can make such a difference and just get you back on track quicker.
And accessing a physio, a women's health physio, obviously it depends where in the world you are, but do you have any advice on that?
my advice is don't be fobbed off. Most GPs now are brilliant at referring into pelvic health physiotherapists. The only problem is that this little thing called a pandemic came along and has meant that the poor NHS is under such huge demands that the waiting list for pelvic health physiotherapists is massive. So if you are offered an appointment on the NHS, keep that appointment, i.e. just keep waiting. If you can afford to go private, I would recommend that. And you can find private pelvic health physiotherapists on a directory called the Squeezy directory, if you Google that. But obviously, if you're on that really long waiting list, I don't want you to have to wait to address your symptoms until that point. So there are various apps you can download. So I love the Squeezy app. I think it's $2.99 and it's from the NHS. It's brilliant. So you can start your pelvic floor regime using that. You can try other biofeedback methods. So there are machines like Kegel 8 and the LV. And these are really good machines that for some women work brilliantly. So then by the time your name comes up on the waiting list, your symptoms may have resolved, which is brilliant. But I am a firm believer in trying to start doing your own treatment first because, unfortunately, especially in the UK, because of the pressures on the NHS at the moment.
When you said that the majority of women, 70-something%, aren't doing pelvic floor exercises correctly, what's the main thing that they're not doing right?
I typically see women only squeezing their front passage. So when it comes to squeezing your pelvic floor, the most important part of the pelvic floor that you actually squeeze is your back passage. So that's not your bottom muscles. You'll know you're doing it wrong if you're squeezing your bum cheeks. It's your back passage. So the best cue that we've seen in research that seems to activate the pelvic floor most effectively is squeezing your back passage as if you're trying to stop yourself passing wind. When you do that, that will also engage the front passage as well. And when I use that cue with most women, when I'm carrying out an internal, that will be the cue that seems to activate the pelvic floor most effectively. And you'll know you're doing it right if you can feel a lift in your perineum, which is that tissue between your front and your back passage. Or if you can just feel a lift internally as well. You'll know you're doing it wrong if, as I say, you're gripping your bottom muscles or your inner thigh muscles or you're holding your breath. And it's a case of just, if you're not feeling that, change position, try it lying on your side. Can you feel it then? If you can, try it then in sitting. Eventually, our goal is to get you as upright as possible, so into standing. But vary your positions and see if you can find your pelvic floor that way. A way of you knowing in part if your pelvic floor is engaging is if you're having a wee and you try and stop it midstream. Now, that's not something you should be doing regularly, but it's a really nice way of you knowing, oh, actually, there's my pelvic floor. Okay, that's what I need to do to stop my urine. Therefore, that's what I need to do when I'm training my pelvic floor. Once obviously I'm not on the toilet. So there's some nice cues to help you engage your pelvic floor. But a really nice way of knowing if you're probably not engaging your pelvic floor that effectively is if after 6 weeks of trying to do your pelvic floor exercises, hand on heart religiously, at least once or twice a day, if your symptoms just aren't improving at all, then that would be a sign where you need to get a little bit more bespoke professional help.
Finally, on the pelvic floor exercises, you mentioned how important breath is and the diaphragm. So when you're doing you said 10 short squeezes, when you're doing the 10 longer squeezes, should you breathe out as you draw your pelvic floor up and kind of try and breathe out for the 10 seconds, or should you try and breathe freely?
Depends what works for you. I really like using the breath for my patients because if you think of your pelvic floor just like your bicep muscle, so if you could see me now, you'd see that I'm bending my elbow all the way up from my hand to get to my shoulder, and then I'm straightening it fully. Your pelvic floor is just like your bicep or any other muscle. It has a range of movements. And we know that when you breathe in, your pelvic floor relaxes, or like your bicep, straightens your arm. And as you breathe out, it contracts, or like your elbow bends. So if when you're doing your pelvic floor exercises, you take a nice deep breath in, then we know we've lengthened your pelvic floor, then breathing out, squeezing that back passage, that's going to engage the pelvic floor fully. And I just think breathing, I don't think we do it enough. I think life's so hectic. We breathe so apically or through the chest. Sometimes I think doing some pelvic floor exercises with some really nice deep breathing, it's also quite nice for some mindfulness as well, just to switch our systems down a little bit. So by using your diaphragmatic breathing, that can really help engage your pelvic floor fully. And actually something I should add is it's not just about the contraction of the pelvic floor, it is about the relaxation as well. So using your diaphragm, using your breathing can really help improve the range of movement of your pelvic floor, but also the strength of it.
It's brilliant. Thank you for all those tips. And just sort of to wrap, I mean, I could talk about this all evening, but just to sort of wrap up, really, do you think that the tide is turning? You know, are women becoming more able to talk about pelvic health? Are healthcare professionals more educated about how to help them? Being, you're right in the thick of it. What do you think?
Yes, I do. If I compare it to 8 years ago, where I felt no one would ever discuss pelvic floor dysfunction with me, I think it is changing. And I think social media's done a lot for the world of pelvic health. I think if women are really proactive and seeking help, then it's there. My biggest concern is more for the lower socioeconomic groups who aren't getting the information. And I think we need to do better at getting the information to those groups of women and to the groups of women who aren't on social media. I mean, I'm sure you'll agree, social media has changed how we view medicine in general. And the likes of these podcasts are just incredible. But not enough of us are engaging in these podcasts and social media. So yes, I think it's improving. I think we still need to keep banging the drum, though. I think we've still got a long way to go to make a difference to everyone, not just those women in our social media bubbles.
Hear, hear. Yeah. Well, thank you for all you're doing, Emma, to raise awareness. You've single-handedly helped thousands through all your social media posts and information and research, etc. So, no, it's brilliant. Do you have any final words of wisdom? Any final message for somebody who perhaps is listening to this who is experiencing stress incontinence when they're running?
My first tip would be, do not be embarrassed about it. It is very, very, very common, as we've established. But it's not normal, and there are lots and lots of amazing healthcare professionals who can help you manage these symptoms. If you are symptomatic, please speak to your doctor, or if you're in a position where you can, seek us out privately. I would also love to add, just please don't pad up and put up with it. It's you know, I think incontinence pads have their role. They allow you to feel more confident and do the things that you want to do, and that's really important, but they are not a solution to this problem. And actually, the solution to this problem is probably an awful lot easier than you realise. And importantly, there is a solution to this problem. The majority, about 85% of women who start on a pelvic floor programme, who have stress urinary incontinence, will be leak-free if they follow the program correctly with compliance.
That's really encouraging words and encouraging statistics as well. So no, thank you so much, Emma. That's been really interesting and yeah, really, really, really definitely very, very useful. And I'm sure lots of the listeners will be, making their appointments and taking action. So thank you so much. And once again, thank you for everything that you're doing.
Oh, thank you too. And thank you so much for having me.
You're welcome. That's it for season 2, episode 3 of the Active Health Podcast. Thank you for joining me. And just a little reminder, you can download this show on your usual podcast app. Please, will you leave me a review? Because it really does help to spread the word and for people to be able to find this podcast. If you want to find Emma Brockwell, her website is physiomum.co.uk, and she's on Instagram at physiomumuk, on Twitter at Emma_physiomum, and Facebook at physiomum. We'll put these in the show notes, so don't worry. And once again, you can find me on my website, drjulietmcgrattan.com. And please do check out our hosts. They're on @Wisp Sports on social media, so you can enrich your feed with wonderful news and stories and conversations from the world of women's sports. You can also head to their website to wispsports.com. So that's it for now. Please do join me again for the next episode of the Active Health Podcast.